Thank you. So I'm doing a presentation on Feeding Futures. It was a virtual nutrition program for individuals with intellectual and developmental disabilities. My name is Trisha Aldridge. I am the Family and Consumer Science Agent in Collier County. So when we look at people with intellectual or developmental disabilities, one story keeps surfacing. They often can't leave their home. Why? Travel limitations, gaps in public or private transportation, geographic isolation. Those all pull them away from learning opportunities others take for granted. They aren't minor inconveniences. These are systematic barriers that quietly shape what people are able to learn, access, and do every day. So according to a study by the United States Census Bureau in 2020, individuals with developmental and intellectual disabilities experience marked disparities in nutrition knowledge and access to health promotion services, largely due to transportation constraints, geographic isolation. The consequences of this reach far beyond mobility. Largely, when somebody can't get to a class or community program, there are opportunities for building foundational health knowledge, like understanding nutrition, are significantly narrowed. So research shows that if we incorporate visual aids, innovative instruction methods, and opportunities for social interactions, we can boost the motivation and engagement, which then turns to improved nutrition-related behaviors. So this tells us something important. How teaching matters just as much as what we're teaching matters, especially for populations that have long been underserved by fits all approaches. So the map that you're looking at, it's from the Department of Health. It illustrates the distribution of individuals. Oops, I got to go back. With developmental disabilities across Florida's counties. So what it reveals is that this is not a small or isolated population. There are tens of thousands of people across urban centers and rural communities alike who face the same fundamental challenge. How did they get there? Because the single biggest hurdle isn't the lack of desire or motivation, it's physical access to in-person nutrition habits, learning how to plan a balanced meal, knowing how to handle food safety. They aren't abstract concepts. They're daily necessities that directly impact the long-term health of people. And yet for some individuals with developmental disabilities, the path to learning them is blocked before it even begins. And the challenge extends well beyond Florida's borders. So consider our residents that go out of state, they share the same needs, students living on campuses, university campuses, without reliable transportation, or travelers and caregivers with limited time or limited access to local programming. So the geography changes, but the gap remains. So if we have to ask, what if access wasn't a requirement? What if a program simply met people where they are? Literally, that's the vision behind this virtual inclusive program. It removes the mobility barrier entirely, and it doesn't matter if someone is in Alachua County or Alaska, the curriculum remains the same. So it's logically the next step to make education truly equitable. So I'm outlining how a virtual game-based nutrition program is intentionally designed to move people not just towards awareness, but to knowledge, for knowledge that's real and it's lasting. And so they're lasting action. So my objectives were to boost knowledge and skills. And so doing that, this goes beyond the traditional lecture style. Rather than simply presenting nutritional facts, the program embeds hands-on cooking demonstrations directly into game playing. So making learning active and experiential. Progress was tracked through concrete metrics. So we did a pre and a post test along with self-reported confidence in recipe preparation. So we can measure not just what participants know, but how capable they feel applying it. So the program also had realistic everyday scenarios. So we planning a balanced lunch, navigating the grocery store on a budget, or making substitutions for diet restrictions. So it bridges the gap between abstract nutrition concepts and the tangible practical skills that people need in their daily lives. So I also wanted to build confidence and independence. So knowledge alone doesn't change behavior. Confidence does. And that's why the second objective ties self-efficacy directly into the program's reward system. So we would complete challenges and they would unlock some confidence badges in some of the games, reinforcing the idea that small, successful steps toward healthier choices are worth celebrating. So over time, these small wins accumulated into larger, and they had the participants had a genuine, whoops, I don't know why I keep doing that, a genuine sense of autonomy and capability. So our surveys revealed a meaningful correlation between the badge collecting and the participants' self-reporting ease in making healthy decisions in their everyday lives. And so my third objective was to foster peer connections, seeing that a lot of these people are isolated at home. So I thought that this third objective recognizes that learning is really it's most powerful when it's really most powerful when it's in isolation. So we had a rich social layer, collaborative cooking quest. We did some live group demonstrations. We did some peer-reviewed recipe cards, and that transformed the experience from a solitary activity into a shared one. So participants were able to give feedback and encourage each other through challenges, exchange resources, and build on genuine learning. And the fourth objective was to demonstrate scalability across populations. So the fourth objective speaks to the program's reach. The platform was built with a flexible architecture, specifically so it could serve diverse populations without sacrificing consistency or quality. It was already piloted with 3 distinct user groups. So we had travelers with limited time, homebound residents who lacked mobility, and digital natives who are just more comfortable in online environments. So each group with the same core curriculum, and each demonstrated that the content adapts effectively for their unique needs and circumstances. So working with local agencies that provide services for individuals with intellectual and developmental disabilities, and also the Florida Special Olympics, we recruited 16 adults between ages 8 and 45. They all had mild to moderate intellectual or developmental disabilities. And it was intentional, this age range, because we wanted participants who were transitioning to or already living independently, where nutrition skills really matter in daily life. So the program itself ran for 6 weeks with 60-minute live sessions each week. And each session was packed with interactive elements, games, polls for real-time feedback, and live cooking demonstrations. And the virtual format meant that everybody could participate from wherever they were. And then the outcome measures was my fourth objective. And so we tracked 5 key metrics to capture different aspects of learning. So food matching activities tested their ability to categorize food correctly. Picture games specifically, we focused on things like identifying healthy fats, which is a critical nutrition concept. And then we did some nutrition label games to identify foods that were high in sugar, fat, and salt. And then we did weekly polls that gave us kind of a snapshot of comprehension. And then in the beginning, I did a 6-question quiz, like a pre-test and a post-test. And they were just 6 questions because we had to do these we couldn't do a written test because of some written communication skills may not have been as some kids may not have had, or adults that may not have had that ability. So, and then we also did where they rated their own cooking confidence in the beginning on a scale from 1 to 5. And then we did it again in the end after the program was finished, just to see, to help us understand the self-efficacy changes. All right, next slide. So I forgot to advance the slide, so now I have to go to the next one. So our key findings were our results actually, I think I've skipped a slide. That's what I did. Okay, so the results exceeded our expectations across every measure. So my headline was the nutritional knowledge, drastic change, a drastic jump. We went from 48% correct answers on that pre-test to 75 correct on the post-test. So that was a 27% point increase, and I thought that was really great. So I think they really understood those nutritional concepts. And then we did the game base that also performed really well. So the participants scored 78% correct in the food and one of the food matching activities, 82% in the high fat identification game, and which was actually the highest score we got throughout all the games we played. And then 73% on weekly poll questions. These numbers tell us that the interactive format wasn't just fun, it was really effective for their learning. So, and then the cooking confidence. This is really where their cooking confidence nearly doubled, or actually it did double. Yeah, it almost doubled. So they started on that scale from 1 to 5 at a 2.1, and at the end it was a 3.8. So I thought that was a pretty good jump in confidence for cooking, or especially for a group of people that may not have ever been in the kitchen cooking by themselves before without a caregiver. So I thought that was a really great finding. So the 94 completion rate was also a great, I was also really proud of that one. So 15 out of 16 participants attended at least 5 of the sessions. So it kept them engaged week after week, which is, sometimes that's a challenge with our educational programs, keeping people engaged and keep them coming back with a 6-week program. And also they consistently reported high satisfaction with the virtual format, and they loved the games, the interactive elements, they loved that. So they said it was easy to follow, keeping the games simple, made them accessible to everyone. And so I thought these results were really good, that it worked really well. So as I wrap up, I just want to emphasize, I talk really fast, so I've got a lot of time left. So what I really want to emphasize what was accomplished here and why it matters for the future for inclusive education. The virtual game-based curriculum, it really delivered on every promise. We saw significant gains in nutrition knowledge. Remember that jump I talked about from 48 to 75% in the cooking confidence, or that was the nutrition knowledge, and also the jump in the cooking confidence, and real developmental, their independent cooking skills. I think that really developed their independent cooking skills. What was equally important is that we fostered a genuine peer engagement. Participants weren't just learning in isolation, they were connecting with each other, building relationships, they supported one another's growth. And now here's where this approach in this game changer for program delivery, why I think this is a good approach for program delivery is because it really didn't cost a lot. The infrastructure costs were minimal. Basically what I did was for the cooking demo, I basically cooked what I was going to eat for lunch. So there was no food waste or food expense feeding up a classroom full of people. And there was no need for a physical classroom. The transportation coordination piece, we didn't have to worry about that. And it didn't take multiple staff members. So I will mention that we did not use the chat. So we didn't actually have to have a second person watching the chat. And that was just to keep everything so that everyone could participate. And then we only had to have one person. And then the content is completely reusable. So I can use it again and again, and without having to recreate any materials. So with just one facilitator, you're able to reach 16 participants simultaneously, and it's cost effective. It was kind of remarkable, the cost effectiveness of this program. And then the scalability means that we can reach populations that traditional programs simply just can't serve effectively. Travelers, out-of-state residents who don't have local services, homebound individuals who face mobility challenges, and anyone that thrives in a virtual environment. So we're not just adapting to barriers, we're eliminating them entirely. So what was demonstrated was that we can generally expand access to life skills education for individuals with intellectual and developmental disabilities, regardless of where they are or how they learn best. The program is not just program improvement, it was a fundamental shift towards true educational equity. So this proves that throughout the design and the right technology, we can make essential life skills education truly accessible to everyone who needs it. And so this is kind of repetitive by proving that low-cost single facilitator virtual game-based curriculum can elevate nutrition knowledge, confidence, and cooking skills for people with intellectual and developmental disabilities. We have opened up a scalable pathway to life skill education. No matter what the learner where the learner lives, or how they best connect, it means we can get to those people we don't normally reach with a online platform that's simple, easy, and builds connections between them. So it created community, autonomy, and empowerment. So resources. And do you have any questions? Oh, what happened? Does that look funny? Or too, okay. So any questions?
Hi, Tricia. First of all, thank you. This was so amazing. What made you decide to focus on these populations? Because, I
Um,
mean,
Actually, the Florida's Special Olympics, they actually reached out and asked me to do in-person programs. And then when I approached it's our agency here that they work with ages 14 to 45, or they do older ones too, but their groups like this are 18 to 45, and they are 14 to 45, and they asked if I could do something virtually for their homebound, or their participants that don't have transportation, their caregivers can't get them to places. So I said yes. And so I had to really think about how I was going to create this, because we're dealing with a lot of different, like I said, it's mild to moderate um, in abilities. And so I thought game based would be fun and interactive, and everybody could participate. So it took a lot of thinking and footwork trying to figure out games that actually could be played online and they could get like their badges. So
that was amazing. Yeah, that was very
yeah.
incentivizing and easy. Julia has a question.
Yes, Julia.
Did you have to get, I don't know if special training's the right word, but did the people at Special Olympics help you develop things so that you were on the correct level?
They did not really. What they gave me was the core nutritional things that they wanted the participants to learn, but they didn't give me a format. So we had to I created a PowerPoint, but I kept it simple. And then I just incorporated the games and the cooking demos into that. And so yeah, they didn't really train me. So, and that was the other thing too, because a coworker, our Sea Grant agent, is going to be working with them in the future, and he was a little nervous because he said, I've never worked with this demographic before. So my time's almost up. So yeah, that's something that we probably need to think about as an IST in the future.